How does EVL treat esophageal varices and liver disease? Imagine a way to stop dangerous veins in the esophagus from bleeding before they cause serious harm. That's what endoscopic variceal ligation, or EVL, does for patients with liver disease. When the liver is damaged, especially in conditions like cirrhosis, blood flow through the portal vein becomes blocked or slowed. This causes pressure to build up in the veins of the esophagus, leading to swelling called varices. These varices can burst and cause life-threatening bleeding, so controlling them is crucial. During EVL, a doctor uses a thin, flexible tube called an endoscope that is inserted into the mouth and guided down into the esophagus. Attached to the end of the scope is a small device that can place tiny elastic bands. The doctor locates the enlarged veins and gently suctions them into the device's chamber. Once the veins are pulled in, the elastic bands are released around their base. This cuts off the blood supply to the varices, causing them to clot and shrink over time. The process effectively seals off the problematic veins, preventing them from bleeding or rebleeding. The procedure is usually quick and can be done on an outpatient basis. It's considered a first-line treatment for high-risk varices or for patients who have already experienced bleeding episodes. EVL is very effective at controlling active bleeding and can also be used to prevent first-time bleeding in patients with large or high-risk varices. While generally safe, some minor risks exist, such as small ulcers or scarring in the esophagus, which usually heal well. EVL is often used alongside medications like non-selective beta blockers, which help lower pressure in the portal vein and reduce the chance of variceal bleeding. Sometimes, doctors combine EVL with other treatments to improve outcomes, especially in complex cases. The goal is to reduce the risk of bleeding, which can be deadly in people with advanced liver disease. In summary, EVL works by physically tying off the enlarged veins in the esophagus, stopping blood flow, and helping the veins shrink and scar. This reduces the chance of rupture and bleeding, which is a major concern for people with liver problems. It is a key part of managing complications from portal hypertension caused by liver cirrhosis or fibrosis. However, each patient's treatment plan is tailored to their specific needs, often involving a combination of procedures and medications. Always consult with a healthcare professional to determine the best approach for individual health situations.